I am a Creek citizen, so I had some experience growing up with the Indian health system as a patient. And when I went to medical school, I intended to do family medicine. I had an Indian Health Services scholarship, which paid for part of my schooling through medical school. And through that scholarship, that also required me to give back to an Indian health facility for 4 years, which was the amount of time that they supplied me with the scholarship. So I obviously chose my tribe, and I came back to Creek Nation when I finished my medical school. Creek Nation also had a really wonderful program that they also helped me pay back some of my loans as well that were in addition to what IHS had paid for, which was incredible. And I had been working for Creek Nation for 4 years prior to leaving, when I saw a need in the community for more rural practitioners outside of Indian health. But Creek Nation really supplied me with a lot of education in impoverished medicine, in taking care of patients who may not have access to things that we have access to in larger communities outside of rural Oklahoma. So I owe a lot of how I practice medicine now to Creek Nation and what they offered me. It's a partnership with the OSU Medical Group, which is a division of the OSU School of Medicine and the OSU Medical Center. Both myself and OSU saw a need in Okmulgee for primary care. Over the last couple of years, we've lost a lot of our primary care physicians here in our community, and it's created quite a wellness drought, a healthcare drought. And so I think both of us were working towards the same goal at the same time, so it just kind of worked out perfectly that OSU was interested in putting a clinic in a rural area like Okmulgee, and I was interested in trying to help the community in whatever way that I could. And so it matched up really well that we were both at the right place at the right time to make this happen. My husband Clinton and I actually own the building that the clinic is in. We had purchased the building years ago with the intention of him having a law practice here and me having a medical practice here. And then when the cards kind of fell into place that OSU was interested in putting a clinic here in Okmulgee, and I had this building that was ready to be remodeled for a medical clinic, we moved forward with that. OSU has funded the remodel for the building, and so all of the state-of-the-art equipment that we have here is funded by OSU, and this clinic is very much run like any other clinic in a metropolitan area. So we have a lot of the same things, and honestly, we have things that a lot of metropolitan clinics don't have because OSU is very wise about rural medicine. One of their mainstays and their focus is to give back to rural communities in Oklahoma. The medical school is focused on that as well. And so they know that in rural towns it's difficult to get an x-ray or to get an ultrasound or to get in with a specialist and those kinds of things. So they have built in all of that into this clinic and making sure that we can take the best care of patients in rural Oklahoma that we can. This is a family medicine clinic, so we do everything from newborns to geriatric populations. I do prenatal care as well, so I take care of pregnant women up until about 28 to 35 weeks gestation. And then at that point we have a really good connection with our delivering doctors at OSU Medical Center so that they take over the care and they get to meet their delivering physician. But it allows a lot of care to be taken when you're close to home. You're not having to drive long distances to see a doctor, to see an obstetrician, to see a gynecologist. We designed this, and I believe OSU chose a family medicine physician like me so that we could do as much as we possibly could for patients in their community. You don't need a referral. OSU has a website that you can look at all of the physicians that are within the OSU Medical Group. You'll find our information on there. They're welcome to call the clinic and we can get them set up over the phone. We do a lot of things through computer now, so they can we can email them their paperwork. They can complete their paperwork on the computer. They can come in and we can give them paper, old-fashioned paperwork for them to complete. Whatever is the most comfortable for them and whatever facilitates their need there. I'm always surprised when anybody is excited to see anything that I've done. We were really excited. We were excited to have the support of the community like that, and to see so many people come out and be excited about medical care improving in Okmulgee. It's a big deal. It's a nice thing to not have to go so far to get care, and it makes a big difference in a lot of people's lives and a lot of people's health. So I'm hoping that with time we really make a big impact on this community and really change the health and the course for a lot of people. Right now the plan is just for me. Fingers crossed that we get super busy and we need somebody to kind of provide me some backup and some help for new patients. I don't ever want to get to the place where we're denying patients from establishing, care with us. And so, if that gets to be the issue, we may hire on another doctor or a nurse practitioner or something like that, but that's not in the works as of yet. It's just me for now. We have 2 licensed practical nurses, so 2 LPNs that work with me. We have a front desk and a clinic manager, an office manager. So we have me plus 4 other office staff. Probably the biggest thing that I want people to know is that we're here. I've had a couple patients who, because I worked with Creek Nation, thought that this was a satellite clinic, which I think is great. But unfortunately right now, you have to be insured. You have to have either private insurance or insurance through your employer to be seen here. But we obviously still have close connections with Creek Nation, and I still talk to a lot of the physicians there, and in fact today made a referral back to the psychiatric department that's there at Creek Nation. So I want everybody to know that we are separate, but we are very much interlinked, and both parties are very invested in making sure we take the best care of patients that we can, whatever way that is.